There are three primary stimulus for the first breath, and we've talked about these in our previous unit. It includes asphyxia, compression of the thorax, and environmental changes. With asphyxia, while passing through the birth canal, blood flow to the fetus is disrupted, which causes a decrease in PaO2. These stimulate the chemoreceptors, which in turn stimulate the respiratory center in the brain to signal the respiratory muscles to perform the actions necessary for the first breath. Remember, the chemoreceptors have been active since about week 23 in utero, so they've been mimicking breathing this entire time during gestation. Now that they're born, the stimulus is increased due to the asphyxiating event. Let's go on to compression of the thorax. This occurs while passing through the birth canal. This does two things. One, it helps squeeze fluid out of the lungs, and as it exits, the chest will recoil, expand to its original size and shape. The recoil creates a pressure change to allow air to enter the lungs. Lastly, we have the environmental changes. These are abrupt change from dark to light, from warm to cold, and from the physical handling of others, because this whole time it's been surrounded by amniotic fluid, and any type of movement has been shielding the baby from the abrupt impact of it. All of these will invoke the crying reflex, which stimulates the first breath. Remember, the first breath has to overcome the surface forces of the lung, the alveoli. These have been measured to be as high as negative 100 centimeters water pressure. This doesn't mean that you could give 100 centimeters water pressure of positive pressure to get their first breath going, but to know that when they're sucking in, that's how much surface tension they're overcoming. This initial breath, which is hard to do because of the surface tension, establishes the functional residual capacity. Each successive breath is easier because the surfactant prevents the alveoli from collapsing now, allowing them to remain open and partially filled with air, i.e. natural PEEP. Let's go on to our next slide. The APGAR scoring system is done typically at 1 minute, 3 minutes, or 5 minutes, and sometimes at 7 minutes following birth. So 1 minute and 5 minutes for sure, and some facilities also do it again at 7 minutes. A on APGAR, the first A stands for activity, and here what you're really looking for is your muscle tone. You get 0 points if they have no muscle tone, if they're flaccid. They get 1 point if their arms and legs are flexed, and they get 2 points if they have active movement, meaning their arms and legs aren't just flexed, but they're moving about. The P stands for pulse. If it's absent, they get 0 points. If it's below 100, it's 1 point, and over 100 is 2 points. G is for grimace, which is really reflex irritability. And this is, if they're flaccid, they get 0 points. If they have some flexion of the extremities, then they get 1 point. And if they have active motion, which includes sneezing, coughing, and pulling away, they get 2 points. The second A in APGAR is for appearance, and here you're actually looking at skin color. If they're blue or completely cyanotic, they get 0 points. If their body's pink but their extremities are blue, and we call this acrocyanosis, they get 1 point. And if they're completely pink, they get 2 points. Lastly, we look at their respiratory effort. If it's absent, they get 0 points. If it's slow and irregular, they get 1 point. And if they have a vigorous cry, they get 2 points. Now, what this system actually tells us is how they're responding to resuscitation. It tells us if our CPR or our NPR has been effective, and it can indicate future impairment, meaning a low score puts the neonate at a higher risk for long-term damage. So if you score lower, that means your CPR has been less effective than if you scored higher. Okay? The score itself does not determine what type of CPR you're going to provide or what interventions you're going to include. For example, let's say you have a neonate that scores a 3. Well, they only got 3 points, so it could be that their heart rate's below 100, and if that's the case, you would need to provide positive pressure ventilation. But maybe they got 2 points for their heart rate, and then maybe they got 1 point for some flexion of the extremities. You don't know where the points come from. So based on the score alone, you cannot determine what interventions you're going to use. You just can determine how effective your resuscitation has been, if that makes sense. Please post questions on this if you have them. Let's go on to our next slide. Here's another look at our APGAR scores. Again, if they score between 7 and 10, there's no asphyxia. They consider this a successful resuscitation and you just need to monitor. If you scored 4 to 6, then they have mild to moderate asphyxia. PPV is probably still required depending on the score for the heart rate or the pulse, but you're going to have some continued resuscitation efforts. If they scored 0 to 3, this is severe asphyxia. You're still going to be continuing resuscitative efforts. You're probably providing PPV, and you're most likely providing some chest compressions, but not necessarily. So again, the score itself doesn't tell you what to do. You have to look at each individual assessment, but it does tell you how effective your resuscitation has been, and if you just need to monitor or continue to resuscitate some more. Let's go to our next slide.